Hello, my name is Marvella Garcia, and I'm going to be talking about the use of virtual reality for the treatment of anxiety disorders. Anxiety disorders are one of the most common mental health afflictions that affect adults worldwide. The number of adults being affected in the United States is about 18.1%. Worldwide, the prevalence of anxiety disorders is about 7.3%. Anxiety symptoms can cause many difficult issues in an individual's life, and these can include impaired or poor quality of life, a significant amount of distress, increased stress overall, substance abuse issues, physical issues, and medical issues. Currently available treatments and different existing models of care are not able to fully and adequately address or deal with the immense global crisis of mental health care that the entire world is facing right now. Mental illnesses account for about 1/3 of the entire world's disability that is caused by adult health issues, and this results in a multitude of personal suffering as well as socioeconomic costs. There exists an unmet need for implementing novel mental health treatments for those suffering from anxiety that do not respond to the conventional evidence-based treatments and other conventional psychotherapies that are currently available. Many individuals suffering from anxiety-related disorders go untreated due to lack of access to healthcare and other socioeconomic barriers. Due to the rising numbers of people that are being affected by anxiety disorders, and with the technological advances and greater accessibility that we now have, such as being able to treat patients in their own homes, virtual reality has the ability to be a useful, cost-effective novel tool that can help bridge those gaps in care and reach more individuals who continue to go untreated. Virtual reality or VR treatment has proven through studies to be an effective tool that can help treat anxiety by aiding in symptom reduction, increasing patient engagement, achieving high retention rates, displaying stable results over long periods of time, and being cost-effective. Virtual reality-based treatments that are used in combination with cognitive behavioral therapy can be used to augment other treatment methods for positive patient outcomes. Virtual reality therapy has many advantages over typical conventional therapies being used to treat various anxiety disorders, such as exposure therapy, which itself can present with disadvantages and many barriers that prevent it from being used. Some advantages of virtual reality therapy over typical exposure therapy are better acceptability by both patients and mental health providers. It can be safer than in vivo exposure. If a patient becomes too overwhelmed by any situation, that patient can quickly escape by simply removing the headset. With virtual reality therapy, you can have avoidance of dropout rates. It eliminates a barrier for those who experience difficulty with imagining or visualization, which are techniques that are used in traditional exposure therapy. Virtual reality therapy also allows for the avoidance of difficulty in arranging an exposure setting outside of the office. And another advantage is that it allows the therapist to see what the patient sees, which eliminates the limitations of conventional imaginal exposure. Virtual reality therapy aims to create a parallel reality and a therapeutically controlled world that provides both an interactive and immersive experience for the patient. Virtual reality is well suited for use in exposure-based treatment for anxiety disorders, as it provides the opportunity for a sense of presence and immersion in the feared environment in a controlled setting. Virtual reality therapy is a tool that can be used to enhance the treatment of anxiety that can be facilitated through the use of different varying technologies through controlled delivery of sensory stimulation by the mental health professional. The equipment used in virtual reality therapy includes a head-mounted display using gesture sensing gloves synthesized sounds, vibrotactile platforms, and 2 monitors, one for the provider interface, where they construct exposure in real time, and one to allow the provider to view the patient's position in the virtual reality environment. An interesting study was done by Lee et al. On a group of patients diagnosed with social anxiety disorder, and in this study they compared the results of virtual reality treatment to a health control group. In this study, they used portable functional near-infrared spectroscopy to observe changes to the prefrontal cortex of the brain, both before and after virtual reality treatment. And they also used psychological scales to assess anxiety symptoms to find a correlation between the two. This study was interesting because it provided actual objective results instead of just relying purely on subjective results through the use of rating scales. The study found that psychological scale scores assessing anxiety symptoms decreased in all of the individuals who participated except for 2. Objective findings showed differences in activity in 2 areas of the brain, the frontopolar prefrontal cortex with a p-value of 0.03 and the orbital frontal cortex with a p-value of 0.04, and these results showed a correlation with the decrease in anxiety symptoms. In another study done by Navarro-Haro et al., a group of patients diagnosed with generalized anxiety disorder was treated solely with a mindfulness-based intervention in a group setting, and the other group was treated with the same mindfulness-based intervention, but 10 minutes of virtual reality dialectical behavioral therapy mindfulness skills training was added. The findings of this study were that virtual reality therapy treatment, when used in combination with mindfulness-based interventions, improved patient dropout rates, with the VR group having 100% completion rate when compared to 70% completion rate in the group without the VR component. There was also an improvement in overall symptoms of patients diagnosed with generalized anxiety disorder. A research study using a randomized control design set out to validate and investigate the effectiveness of virtual reality therapy as a therapeutic treatment when used in conjunction with cognitive behavioral therapy, or CBT, for the treatment of panic disorder, anxiety, and depression. A VR self-guided mobile app was created which included 4 steps in which patients were taught how to cope with their panic symptoms as they arose while gradually being exposed to different phobic stimuli. The cognitive behavioral therapy techniques that were taught and encouraged to be used throughout the different stages were psychoeducation, abdominal breathing, and muscle relaxation. The results showed that the virtual reality therapy, when used in conjunction with the cognitive behavioral therapy techniques, were effective in reducing panic disorder symptoms when the pre-treatment and post-treatment scores of the Panic Disorder Severity Scale were compared. A meta-analysis research study was done to evaluate VR therapy for different severe anxiety disorders when used with cognitive behavioral therapy compared to cognitive behavioral therapy being used alone and waitlist. The study analyzed a total of 16 trials, which included a total of 817 participants. The final results of this study displayed that virtual reality therapy with cognitive behavioral therapy was equally as effective as cognitive behavioral therapy when used alone and more effective than waitlist. Here I will go over some recommendations for potential implementation of virtual reality therapy for the treatment of anxiety disorders. For a novel technology to effectively be adopted into practice, training really is key. This training should include equipment training, be clinically relevant, widely available, and be able to address any potential concerns by providers. Virtual reality should be incorporated into practice at the same point that in vivo exposure would begin in treatment sessions. In order to have effective and personalized treatment, an expansive library of VR content is ideal and would need to be developed. For successful dissemination, exposure therapy should be normalized and clinicians' concerns minimized. There should be the development of several resources to help clinicians learn the therapeutic uses of virtual reality therapy. Researchers should advocate for the development of accredited continuing education classes. And any students training to become mental health practitioners should have virtual reality training included in their curriculum for use as a therapeutic tool. Making the benefits of virtual reality treatment widely known through promotion to both mental health professionals and the general population will increase patient demand for this treatment and motivate therapists to utilize and offer virtual reality therapy as a treatment option. Virtual reality is becoming increasingly affordable, with costs of both hardware and software declining. Costs should also drop as demand rises. Virtual reality content has increased in both quantity and quality, so there's a lot more selection now available for providers to access and use. A wide selection of virtual reality products and apps can make it difficult for clinicians to decide what to purchase and what to use and what's best for their practice, so research will be necessary on the clinician's part. Also, research should continue on the implementation of virtual reality therapy treatments in different clinical settings. Regarding implications for practice, continued advancing technology, when applied, can help mental health professionals to manage their large caseloads with the ability to focus only limited resources in the treatment of patients with diagnosed anxiety disorders. Research is currently being conducted to discover if virtual reality could possibly be applied to helping assess mental health conditions in the future, which would help to improve accuracy and speed in the diagnosis of individuals suffering from anxiety disorders. Virtual reality treatments would also offer to mental health professionals the ability to manage clinic throughput while lowering costs associated with intense and various types of treatments. This would also help in removing the time required of mental health professionals when arranging real-world exposure, due to the fact that this type of therapy can now be done in the safety and convenience of the office. VR in practice comes with many benefits, including allowing the patient to not only learn anxiety management skills in a therapist-controlled environment, but practice these skills, thus reinforcing patient involvement and increasing the positive therapeutic alliance. With advances in technology, VR may also be the modality in which standardized clinical training for exposure therapy could be delivered, making clinical training more accessible. VR treatments could truly help to overcome barriers and obstacles to delivering quality, effective treatments for anxiety disorders by minimizing patient fears and optimizing chances of patient success, according to Bolt et al. Some factors that VR use in treatment has shown, such as keeping patients engaged with therapy and increases in retention rates, indicate big implications for the treatment of anxiety disorders in remote and underserved areas. These are areas where retention rates in treatment programs are usually low due to high dropout rates. Increased patient engagement and retention also indicate that virtual reality can be very useful for patients that are resistant to the existing and conventional methods of treatment for different anxiety disorders. Technological advances and greater accessibility, like having the ability to treat a patient in their own home from the office, makes virtual reality therapy a useful and vital tool that can bridge the gaps of the unmet needs of the rising numbers of people affected by anxiety disorders who have limited or no access to necessary mental health treatments. Here are a list of references that were used throughout the presentation, and I thank you so much for your time and for viewing the presentation. Thank you.